Hey guys, it's Dr. Justin Marchegiani here. Hope everyone's having a fabulous today. We are going to be going into root causes of bloating. We did a nice long podcast today on it, so click below to get that link to that podcast video. Bloating is a sign of a couple of typical things. It's going to tell us that we're not digesting our food thoroughly, whether it's enzymes or acids or not enough bile support. It could mean we have an infection. It could mean that we're overly stressed. We'll go into some of those root issues. Before we do, make sure you smash that like button if you guys are really enjoying the content. Really appreciate it. Make sure you hit the bell so you get notifications. Put your comments down below in regards to what your experience with bloating is and what's helped and what hasn't. All right, let's dive in. So bloating, one option is the food that you're eating, it's fermenting. It's kind of rotting, it's putrefying, it's rancidifying inside of you because you're not breaking it down all the way, right? So it could be an enzyme acid issue. That fermentation, the rotting of the carbs, the protein, the fats, and that's going to create gas that can create that bloating distension feeling. Of course, number two, we could be doing too much acellular carbohydrates, refined grains, processed foods, more sugar, and of course, that's going to selectively feed a lot of the bad bacteria, which will produce more methane, more hydrogen gases, and make you feel that bloated feeling. Also, on top of that, if we have taken antibiotics in the past, that's going to create a fungal overgrowth or make us more prone to have more bad bacteria. So repetitive antibiotic use is definitely going to be a thing that could drive more bloating as well. Now, of course, I see a lot of patients that have chronic infection. So you could have a chronic H. pylori infection, fungal infection, bacterial infection, fungal overgrowth, SIBO, right? Small intestinal bacterial overgrowth, parasites, all those things could be possible, and they could be driving more gas, more fermentation. They could be affecting your body's ability to break down and digest food. And of course, all of that's going to impair motility. Food's going to sit inside of your intestinal tract longer, and you're going to feel more bloated. You're going to feel like you have more indigestion. So that's definitely a possibility in what is going on. And of course, the more bloating we have, right, it's usually because of certain hydrogen and methane gases. And a lot of times with methane gases, we may see more constipation because the methane can actually disrupt and slow down our motility. It can disrupt our migrating motor complex. Say that 3 times fast. Migrating motor complex. That's the wave-like contractions that move food or stool through your intestinal tract. And if things go too slow, that can cause you to reabsorb a lot more of the, let's say, the toxins from your fecal debris, right? And that's not good. That can stress out your immune system. That can stress out your hormones because there's a lot of maybe undigested hormones that are packaged up there that are going out the body, and that could really throw off your hormones. So like one other kind of connection or tributary to this video is, hey, this stuff, bloating, could also affect your hormones, and here's how. Because it can throw off your motility, and as we're moving that debris out, it goes too slow, and we start to reabsorb it, and those hormones go back into your body and can throw off your natural hormone balance. So in functional medicine world where I operate, we're looking at the root cause. We may give digestive support. We may give activated charcoal, palliative-wise. We may do certain probiotics to kind of help support that so you feel better in the meantime. But we also have to go back and get to the root cause. So certain testing will be done to figure out what kind of infections, what kind of stressors are there. We may also look at diet and lifestyle strategies. If we're eating when we're stressed, we have a lot of cortisol, a lot of adrenaline in our body. We have low thyroid function, which can throw off motility. All those things could be a player in why we're more bloated. So we have to look at the hormones. We have to make sure we're not hydrating when we're eating. We're not eating when we're stressed. We're chewing our food up enough. So at least 1 chew per tooth, 32 teeth, 32 chews. Or at least chew your food up to an oatmeal-like consistency. That's pretty good advice. And you can start from there. And if we have to dive in and do testing on the hormones or the thyroid or the adrenals or female hormones or the gut, we can do that. And again, I see patients all over the world. So if you all want to work with me or my colleagues, I'll put a link down below where you can reach out. So in general, got to get to the root cause. It's going to be really easy to do Pepto-Bismol or some kind of an anti-gas-X kind of thing on the medical side that just kind of palliatively treats things, but it's not going to get to the root issue. Most of the time, people are going to go see their conventional medical doctor, and they're going to be diagnosed with IBS, which can have bloating, it can have diarrhea, it can have constipation. It just means they've ruled out irritable bowel disease, Crohn's, ulcerative colitis, acid reflux, ulcers. They ruled out like all the big stuff, right? And they're like, hey, there's nothing left that's serious, so we're going to give you this IBS label, which is a disease of exclusion. They've excluded all the big stuff, and now they're like, well, you got this issue, so now we're going to give you this disease, which means we don't really know what the issue is, and we'll just try to manage it with some of these medications over here and hope the side effects don't get worse than the actual symptoms. So it's kind of a hope and pray kind of model. And they're not really looking at an underlying mechanism. Why do you have these issues? Why do you have the bloating? Why is that gas there? It's not really even thought about. They're just, hey, let's just give these meds to you, and hopefully those symptoms are managed and the side effects aren't worse. So we want to get to the root issue. So we're looking at SIBO, we're looking at H. pylori, we're looking at low stomach acid, we're looking at bacterial overgrowth, we're looking at candida, we're looking at the diet, we're looking at natural migrating motor complex support. We're trying to get to the root cause. We may give some palliative support over here, probiotics, activated charcoal, other things, but we got to get to the root cause, and that can be a little bit stressful over time if you're not doing that, because it's like you're playing whack-a-mole, and it's easy to get discouraged. Let me go into a couple of questions from you guys. We'll try to keep it on the topic of bloating and digestion. Can breastfeeding moms take Xifaxan for SIBO constipation? You'd have to check with the medical doctor that's prescribing them. That tends to be a safer antibiotic because it stays more localized in the gut. Doesn't quite go as systemic, but anytime you do an antibiotic, when you're breastfeeding, there is a risk. I have bloating on the right side, constipation, fatty stools by gallbladder and pancreas, liver are normal, ultrasound. My blood tests are normal to serum protein, just a little bit high. Okay, yeah, so all the things I said in this video would be pertinent. Nothing I want to add then. Reference to above medical practitioner has mentioned no medicine and has said to me, early to bed, early to rise, eat more greens, and avoid protein. Is it good enough in what you say? So all the things I just mentioned, everything I just mentioned. So they're just trying to like give you some stuff to kind of make the symptoms go away. They're not getting to the root issue. So if you're having a problem with protein, I'm automatically thinking hydrochloric acid, enzymes. I'm automatically thinking not digesting our food. I'm thinking, well, greens, well, what kind of green vegetables? There could be a lot of FODMAPs there, a lot of fermentable carbohydrates. So it matters what you're actually eating, because even healthy foods could have a cost if there's other infections that are present, especially the fermentable carbohydrates and SIBO. So yeah, you really want to hook up with a good functional medicine doc that can kind of get things lined up for you. Consistently taking blood glucose to make sure not pre-diabetic, 1 to 2 hours after eating, always between 78 and 85. That's good. One time after eating, it dropped below the original starting point. That's a good thing, right? Probably not a good thing. That's what we call reactive hypoglycemia. If it drops that fast, it just depends what you ate. If it was a good protein and fat-based meal, it's probably okay. It depends on how fast did it drop and how did you feel afterwards and what you ate. Typically, you see that with more refined carbohydrate and refined sugar. You see a greater drop because your body takes in this insulin or this sugar, right? That sugar then goes up fast in your blood. The more refined and processed it is, the faster it goes up. The faster your blood sugar goes up, the faster your pancreas says, whoa, what's going on? And it shoots out a whole bunch of insulin to react it, right? The slower the glucose goes up, the more your insulin chills out and kind of pumps up a little bit, drips up a little bit. The faster it goes up, the faster it pumps up that insulin. And then what goes up goes down. So what goes up fast goes down fast. And that's typically where you get the hypoglycemia, because it's reactive. Your pancreas is going, whoa, and then bringing that blood sugar down faster and even a little bit lower. And that can create more symptoms like mood and energy issues and anxiety, and that may make you feel worse. So, and then it creates more cravings an hour later, and then you're more likely to reach up to the same thing. It's like this, most patients, especially a lot of women I see, that is this vicious roller coaster they're on, and it really throws off their female hormones. It really can create estrogen dominance and really make their female hormones go haywire. I'm bloated all the time, not only after eating. For the past 2 months, labs pH 6, protein, hypercalcemia, irregular parathyroid, only able to eat fish, poultry, and some veggies. Help, please. So I'm not sure what pH 6 stands for. Oh, I think you mean your pH, right? Like your body pH is 6. Urine or saliva? Because I mean, obviously, it's not going to be blood, because your blood, you'd be dead if your blood was a 7. I'm sorry, a 6. Your blood's between 7.3 and 7.4 all the time, or you'll be in a coma. So probably more urine, I'm going to guess. Protein, hypercalcemia, so high calcium. So I'd want to look at the thyroid. I want to look at the gut. I want to look at I want to look at vitamin D levels too. So I'd have a lot more questions that I would need answers to before I actually made specific recommendations there. So if you want to reach out to me personally, you see me in the clinic, I would want to do some testing to get to the underlying issue. Diet is low carb, glucose levels as above, but get major bloating after fat tea. I feel great, but look pregnant. Is that the fat? Well, you're probably having a hard time digesting it. So we may have to look at supporting your digestion better. And there may be some other underlying infection that's creating those problems. We want to look a little bit deeper. Dennis writes in, what would cause vomiting, yellow, bitter fluid almost always every morning? Sounds like you're not digesting fat. It sounds like that's almost like bile coming up and you're not breaking down your fat. So I'd look at food allergens first. I want to know what you're eating and why is that? It could be an infection. Could be an infection, may not be breaking down that fat. What's going on? Is there any gallbladder issues, any pancreas issues? I want to look a little bit deeper. Is there a connection with certain foods? Is it every single meal? I want to run some gut testing. I want to try some digestive support. I want to see if we get the fat digested better, how much that fixes the problem. So I want to look a little bit deeper. Noticing in my practice a lot of bloating right now, it's tied to stress and anxiety. Yeah, so 100%. The more your sympathetic nervous system's in overdrive, the sympathetic nervous system, the fight or flight nervous system response takes blood from the intestines and puts it to the arms, right, and the legs to fight and punch and flee, right? That's the natural stress response. When blood goes away, all the digestive secretions, hydrochloric acid, enzymes, all that fluid needed to digest and absorb food also goes away, so then you can have a lot of indigestion. So really, do a 5 or 10 minute kind of prayer or meditation before you eat. Be thankful for the food on your plate. Have a sense of gratitude with your creator or God or spiritual endeavor, whatever you do. Just try to have that level of appreciation because that's going to help you get into that parasympathetic state and you'll digest your food a lot better. So that's a really, really good point. What antibacterials do I use for SIBO? So if you go to justinhealth.com/shop, you can see some of my GI clearing herbs there, 1 through 6. And I use them for different things. And there's some special order stuff that we'll do if certain infections, because most people kind of just think they have one thing, but a lot of times there's different layers of things and we have to keep that in the back of our head. Hey, Kathy, hope you're doing well. Does low stomach acid cause adrenal fatigue or does adrenal fatigue cause low stomach acid? Both, because if we have poor digestion and then the food's sitting in our body and creating like bloating and gas, that can create stress. But if we're really stressed and that's creating that sympathetic response and shunting blood elsewhere from the intestines, that can create it too. So yeah, it's bi-directional. Stress can come in both ways, right? It's not just one way. Would you recommend Motility as a safe supplement for treating for SIBO while breastfeeding? Or do you recommend for better elimination while breastfeeding? Yeah, you could do Motility while breastfeeding. I mean, it's just ginger. It's a fat-soluble vitamin C. It's L-carnitine and 5-HTP, if I remember correctly. That's pretty safe. Does activated charcoal help with bloating and absorption of bad bacteria? It can. Activated charcoal is really good at helping bloating. It's going to be palliative. It's really good for like if you're consuming like some not so great food. Like I had some sushi and white rice on Friday for my wife's birthday, and I had a little bit of activated charcoal and some extra enzymes and acids. We use tamari soy sauce if we do any, and then we'll do like coconut aminos or the red boat or the red fish oil. The red fish, I think it's called, red boat fish oil, whatever. It's like a soy alternative that's paleo friendly. Those are all good options. Excellent questions, guys. Really good. All right, anything else, feel free and let me know. If not, I'm going to go jump on a patient call here, and I may be back later on. I may jump on a whiteboard and do a video for you and have it uploaded tomorrow morning. So let me know what you guys want to see, what's on your mind. Really appreciate it. I'm just kind of all done with the coronavirus thing. The stats are going crazy because there's just a lot of subjective diagnosis to everything now. You don't even need a positive test result. So numbers are going crazy. In my state, Texas, like no one's got it. It's unbelievably low. It's crazy. I think the economy's opening up this week, which is awesome. I want to see my friends and family who are entrepreneurs. I want to see them going back out there and getting in the workplace and being safe. And people who are immunocompromised or have a lot of comorbidities, you may want to hunker down for a little bit longer. But like I talked about before, work on your immune system. No one's talking about it. Okay, little girl writes in, when would you suggest taking activated charcoal during the day to help with bloating? In between meals, 2 hours after food and stops, 1 hour before is a pretty reasonable time. Great questions, guys. Great questions. Anything else? All right, guys. Have a phenomenal day. Great chatting with y'all. Take care. Comments below. Thumbs up. Subscribe. Hit the bell. Really appreciate it. Bye, y'all.